So in my clinic, I provide a whole gamut of treatments for men and women over the age of 18. And within these gamut of treatments, I provide botulinum toxin, common name is Botox. This is where the muscles of the face are relaxed and therefore the skin overlying it, you have reduced etched lines, especially for the upper face. I also do things called dermal fillers. These are hyaluronic acid, which is a substance that naturally occurs in the skin but is gradually diminished over time. And when it diminishes over time, then you can get a sunken face, you get nasolabial lines, these etched lines, marionettes, these lines that form here, and puckering around the mouth. And what the fillers do, they add structure, volume and hydration to the skin. And common brands are things like Belotero, Restylane, Juvederm, that people may have heard of. I also do more advanced fillers. These are called biostimulators, and what they do when injected, they promote your own body's natural capacity to restore skin volume and hyaluronic acid and elastin and collagen. And people may recognise the terms or the brands such as Profilo, Sculptra, Radiesse, Elance. I also provide PDO thread lifting. What PDO threads are, this is something that we've used in medical practice for years, and they're like stitches essentially. And what I can do is insert these stitches in a subdermal plane and essentially reposition the skin, because often we fall forward or our skin loses elasticity, and because our bones get lost as we age, our bone structure becomes depleted. What those threads do essentially just reposition. So that's a really nice treatment, and not as invasive as people think it is. I also do Aqualix, which is a fat dissolving procedure for underneath the chin, which reduces submental fat. I do non-invasive things like medical peels, microneedling, dermastamping, mesotherapy, and prescription-only skincare. But the thing is, it's not to get too overwhelmed by the variety of treatments that I have. When I see you, I will, when you've told me what concerns you have, what it is that bothers you, I will then give you some options, what I think which would work the best for you. And then we can concentrate, and I'll describe a little bit more about the pros and cons of certain treatments. The other thing, because I am a doctor and your well-being is my utmost concern, if you come to me wanting non-surgical treatment, and I think actually your best bet is something like surgery or laser therapy, even though I don't provide those myself. I have connections with other aesthetic doctors and plastic surgeons, and I will advise you truthfully whether actually that will give you your best result.